Schrader. What an inspirational talk that you've given, and I love that you recognized and encouraged those that are in the trenches working through this. It's not a surprise to see the successful award that you've received today in acknowledgement of your efforts. We'll move forward now to the ACCP Clinical Practice Award. This award is given in recognition of outstanding contributions in the area of clinical pharmacy practice. Criteria considered by the awards committee in reviewing nominees and recommending candidates include the development of innovative clinical pharmacy services, documentation of the impact of clinical pharmacists, leadership in the development of cost-effective clinical pharmacy services, or sustained excellence in clinical pharmacy practice. Joyce Uchia Lee has been a health science clinical professor in the Department of Pharmacy Practice at the University of California, Irvine School of Pharmacy since March 2020. Before that, she practiced in Singapore from 2007 to 2019, most recently as an associate professor of clinical pharmacy at the National University of Singapore, where she established several ambulatory care and community clinical pharmacy programs, including the first hospital-based pharmacist cardiovascular risk factor management clinic in the country. She has published extensively on the beneficial impact of her services on clinical outcomes and healthcare cost. After joining the faculty at the University of California, Irvine's newly established PharmD program, she initiated a comprehensive medication management program for patients at a federally qualified health center. John Paul Gallagher, professor and deputy head of clinical services in the National University of Singapore Department of Pharmacy, highlighted Dr. Lee's practice innovations in his letter of support. Quote, Dr. Lee's first innovative clinical pharmacy service was at the National Health Care Group Polyclinics, where she established the hypertension, diabetes, and lipids clinics. This was a significant milestone in the establishment of clinical services in Singapore, as it was at that time the first primary care multi-disease clinic established in Singapore. There was a need for such clinics locally and regionally, as the prevalence of diabetes in Singapore and Southeast Asia is significantly higher than in other parts of the world. With this rising diabetes prevalence, the conventional care model commonly found in Asia, where physicians are the sole caregiver attending to the needs of many patients, this is a challenge in the delivery of holistic care. The services that Dr. Lee established were shown to improve clinical and humanistic outcomes and did so on a sustainable basis. The success of these HDLC clinics continues to expand within the National Health Care Group Polyclinics area. Building on the success of these services and clinics, Dr. Lee looked to expand services into retail pharmacy. In 2011, Dr. Lee established the Sweet Spot program with Unity Pharmacy, one of the 3 major retail chains of pharmacies in Singapore, and 5 years later established the D-Care program with another one of the retail chains, Watson's. The Sweet Spot program used point-of-care testing and was successfully delivered by community pharmacists trained by Dr. Lee across 3 sites. It was very positively evaluated by the patients who availed themselves of these services. The D-Care program, building on the success of Sweet Spot, was a community-based diabetes MTM service. This service was established across 4 sites and was shown to improve transition of care and communication with the patient's healthcare teams in different health institutions. End quote. Dr. Lee was recognized as an ACCP Fellow in 2017 and received the 2018-2019 National University of Singapore Faculty Teaching Award, as well as the 2017-2018 University Annual Teaching Excellence Award. At the time of her nomination, she had published more than 30 original research publications and written or co-written over 20 published abstracts or poster presentations. I want to congratulate Dr. Lee as this year's winner of the Clinical Practice Award. Congratulations, Dr. Lee.
Thank you so much. I'd like to thank ACCP and the award committee for this incredible recognition. I am deeply honored. ACCP was my way to stay connected with colleagues and best practices when I worked overseas in Singapore for 11 years. It is also a place where I continue to be inspired by many great thought leaders of pharmacy profession, such as Dr. Bill Kehoe, Dr. Gary Yee, and Dr. Kelly Good. Receiving this award made me reflect what pharmacy practice means today. And I want to share with you a patient story from Singapore that later defined what pharmacy practice means to me. This patient was a Muslim with uncontrolled type 2 diabetes and using insulin. As a devoted Muslim, this patient wanted to observe Ramadan during the holy month, but this meant that he will not be able to eat or drink water during the daylight hours for the duration of 1 month. The patient has been discouraged by his care team from fasting, stating that he will either suffer from glucose toxicity or severe hypoglycemia. The patient therefore felt guilty, depressed, and loss of belonging to the Muslim community. To me, pharmacy practice means being creative and innovative for our patients, taking extra miles to make changes that encourage inclusivity and providing individualized care while embracing diversity. Pharmacy practice also means finding like-minded people to be adventurous and to explore, turning challenges into solutions. For this patient, I ended up writing and validating a dose adjustment algorithm in collaboration with my physician and nursing colleagues from different health institutions with the purpose to empower many others, just like this patient, to be able to fast safely while still being able to maintain what is important to them. Today, you can find this algorithm being used in different healthcare institutions in Singapore. Just for the collaborative origin of this algorithm, the Clinical Practice Award that I am receiving today is really the work of many who have inspired me, supported me, and encouraged me in my career so far. Specifically, from my Singapore days, I want to acknowledge my physician mentors, Dr. Keith Chow, Dr. Elaine Tan, and Dr. Sabrina Wong. My colleague, Dr. Paul Gallagher from the National University of Singapore, and my team of super clinical pharmacists, including Ms. Hui Ting En. And in present day, I want to acknowledge my amazing colleagues from UC Irvine School of Pharmacy and Pharmaceutical Sciences and the UCI SQHC. I must also thank my husband, Alex, for always being so supportive of everything that I do. If the saying behind every great man there's a great woman is true, then the other way around must be too. Last but not least, I want to dedicate this award to all the frontline pharmacists working tirelessly during the pandemic. Stay safe and stay well. Thank you, and thank you, ACCP.
Wow, Dr. Lee, what a powerful example of what it means to be that frontline pharmacist building health equity and being an inclusive leader and embracing all the diverse challenges we see. Thank you for all the work you've done to represent what clinical pharmacists can be in making a difference in the health of our patients and meeting them where they are.